Welcome back to Healthcare Consumerism Radio. This is Brent Macy, co-host, and Doug Field, and would like to welcome a special guest to the program today, Dr. Peter Goldbach. He is with Health Dialog. Welcome, Peter.
Thank you. Thanks for inviting me.
Great. Now, Doug and I have heard a lot about Health Dialog, but for our audience out there, kind of give us kind of the one minute overview on Health Dialog, and we'll dig a little bit deeper over the segment.
Oh, well, thank you. Well, Health Dialog is a national company that provides total population health solutions. We provide wellness services, coaching for chronic conditions, shared decision-making that helps people who are facing preference-sensitive medical conditions, and we provide the analytics and programs that allow health plans, ACOs, and large employer groups to achieve their health care objectives.
Doctor, this is Doug, and again, welcome to this program. You know, there's a lot of confusion in the marketplace and a lot of frustration, I would say, with large, mid-sized, major employers and even their health plans as to how do we get the right return on investment out of our population health management program? How do we get engagement? What is Health Dialog doing to really help answer those questions and help your customers and their individuals, get the most out of their population health management programs?
Well, I think, one very important aspect behind that question is understanding that those results hinge upon understanding your population, understanding your opportunities for improvement, and being able to deliver programs that can give you measurable outcomes. So, it is there is a significant need, as I'm sure you know, to make healthcare more efficient and also to make healthcare more patient-centric and deliver more quality care. So those are things that can actually be measured, and, a thoughtful program would, start with an understanding of your population and would design some solutions that could be tracked as you go along. And so I think those are the things that we try to do with our clients.
Yeah, it's interesting. Normally businesses in this country move away from things when they don't appear to work. And, I've been around this industry for longer than I'd probably like to admit. But I came into this market in the late 80s or so. So that was back when wellness was trying to be in vogue, and now here we are again. But the interesting dynamic is employers are not pushing back. Employers are saying, how do we get it done, correct? So, they are open to, listening to your type of business cases.
Yeah, I would agree with that. I don't think it's actually surprising when you realize that what kind of a big problem we have with lifestyle in this country. Mm-hmm. The World Health Organization, for example, estimates that 80% of non-communicable disease is related to lifestyle. Mm. And, I think you and I, judging by the time you entered the market, are contemporaries.
Yeah.
So I can tell you that when I got educated in medical care and when I was out there delivering medical care, it was all about illness. Yeah. And, I wasn't educated in wellness. Yeah. Yet we have an epidemic of obesity. About 20% of our population smoke. There's too much sedentary lifestyle. And 3/4 of all the money we spend is spent on chronic illness, mm-hmm. which is related to lifestyle.
Yeah.
So I think it's a real advance that we're finally paying attention to lifestyle and designing programs that we can track and that we can endorse. So I'm glad to be part of the fray.
Yeah, there you go.
Yeah, Doctor, my question, a lot of what we talk about at the Institute is empowering employees to become better consumers of health and healthcare. And one of the things, in your opinion, what's the patient's role or the employee consumer's role in a wellness program?
Yeah, they are the central focus. I think that we vote every day on our health with mm-hmm. what we eat, how we spend our day, how we deal with stress and sleep and depression and things like that. So these programs need to be designed, they need to be engaging. If we don't engage people, we're not going to win this battle. So they've got to be not only engaging, but they've also got to be, sort of fun, part of your life day to day. they got to be helpful, because these kind of changes don't come easy, right. And you need an effective program.
What are examples of some steps that you work with you and your team work with to enable people kind of to follow to get the most out of their program? Give us some examples.
Well, there's any number. I would say, first of all, on the engaging side, it's really helpful to understand the population you're talking to, so you can use the right language, the right messaging, and deliver a program that's truly personalized, because every person's path to change, it's very different. So you've got to have a program that is personalized, is fun, so you can use things like gamification. You can take advantage of social networks, because people like to do things with their friends. You can use challenges, and you can make it easy. So if it's on your mobile device, if it's something you check in every day, if there's a challenge that you and your friends are involved in, if you can author a challenge for your friends, these are all ways to make it fun. And also, this is not just about physical health. This is a lot about emotional health and well-being. So, people appreciate that as well, incorporating those elements.
Yeah, go ahead, Brent.
Doctor, for our audience out there, are there specific pitfalls that they need to pay attention to and make sure that they avoid them around engagement?
I think there are specific pitfalls around types of programs. I think it's true that wellness has been around a long time, and I think it's starting to truly grow up in terms of programs. So, really holistic programs that show up at work, that are incorporated into a culture of health that the company adopts, that the leaders are out there and committed, that wellness activities occur in your workplace. They take advantage of community activities, and they offer sort of multiple ways of getting involved, not just online, but in person, telephonically. A lot of the money that employers spend is on chronic disease, and people that have chronic disease, it's chronic, and they're dealing also with wellness issues. So they're in these programs, and it's good to have resources available to them as well, such as coaching, so that they can be more effective in taking their medications and leading a lifestyle that helps them cope with their illness.
It's really critical for employers, too, to have that, I think you just alluded to really have that top-down buy-in and not just in talking about it, but participating in it, correct?
Yeah, absolutely. That's probably the major thing that you just can't tack it on to your website and then hope it works. This activity, by the way, is a global activity. And I was just going to say, thinking about our corporate, our company, corporate parent, excuse me, I'm struggling for words, Bupa is an international company, and Bupa is going to deliver a wellness solution to 62,000 employees across the world. So, it's not just the United States, it's Europe and the rest of the world. Understand that lifestyle is powerful. It's not just medical intervention, which can maybe account for 10% of premature deaths in the world, but about 40% of premature deaths is related to lifestyle.
It's interesting, Doctor, that you mentioned global, because you'll hear an announcement in the near term from the Institute of Healthcare Consumerism where we will be very involved with several global health initiatives because of what you just stated. It is a global footprint and impacting a lot of companies here that are obviously have multinational presence, around the globe. So it was interesting to hear you mention that.
Doctor, I guess the question I know we all have is, you got the ACA out there, so you have the healthcare law. Where, wellness, where does it fit within ACA? What are the advantages it was provided given ACA? Any disadvantages to wellness through ACA?
Well, clearly the government has signaled, I think, through ACA, a very significant interest in encouraging wellness programs, and they have allowed employers to use an incentive of up to 30%, I believe, of the monies devoted for health care as a way of providing incentives that employers can use to encourage participation in wellness programs. And, my own personal view about the ACA, and I'm quite fond of this notion that we've got to change things. Yeah. We've got to change the way we pay people. We've got to provide equitable care in this country. I believe that wellness is going to continue to get better in terms of the way we do it, and more prevalent in the fact that it will be all over. I look at cities like New York City, where they've done a tremendous job with these kind of wellness programs about nutrition, about activity, and they're a great example that you can really achieve meaningful, measurable goals in health through programs like this.
Doctor, talk a little bit more about health incentives, because it can be a two-edged sword, can it not?
Right. I mean, yeah, you clearly, it can be a blunt instrument, I suppose, right? That's probably a better. Yeah. Right. But I think that we all respond to incentives of some type, but I think it's good to understand the limitations of, for example, a financial incentive. Using motivational speak, I would say financial incentives are extrinsic motivators. They are certainly, that financial reward will get me enrolled in that program. But will I do anything in that program except maybe the minimal necessary to collect my incentive? It really depends on the program. So if that program is targeting my needs, providing me with resources that really matter in my life, and help me achieve a goal, and provide me with a tool that's easy to use, then that program is going to have more success.
Right. Doctor, we got about a minute and a half to go here. And so, first of all, I want to thank you for your participation on the program, and I want to give you an opportunity to kind of leave our audience with 2 or 3 clear takeaways.
Well, I think that the clear takeaway is we now understand what we're up against in terms of non-communicable disease. We know that this is a problem that medicine can alleviate, but lifestyle can significantly change. We have programs that are getting better and better over time. There are a lot of ways of describing more effective programs, but I think the big thing for us all to take home is that there are programs that deliver measurable outcomes, and that should be a part of the program that you adopt.
Thank you. Doctor, really, really appreciate you joining us. Enjoy your Labor Day weekend. I look forward to a continuing discussion at some point in time.
Thank you very much.
Thank you.
Stay tuned for the next segment of Healthcare Consumerism Radio.